Hello everyone, welcome back. Today I am going to cover regarding timing and causes of death after trauma. This will revolve around the Trimodal mortality model that include immediate death at the first peak, early death, second peak, and late death. In the timing of death, the first peak in the classical trimodal model of trauma mortality is immediate death occurring within minutes of the surgery. These patients are declared dead on the scene or die shortly after arrival to the hospital within 1 hour. The second peak in trimodal distribution, early death, defined as death within hours of arrival to the hospital. These include death within 24 hours of arrival to the trauma center, excluding immediate death. Trunki et al. Estimated around 25% to 30% of all trauma deaths in this second peak. For the late death, it is defined as those occurring days to weeks after the injury among patients who survived the initial insult. Trunki's original description of the trimodal distribution, 20% are of trauma death in the late death. Study by Gans and colleague, 2010, the late death studied only occur around 9% of cases. The causes of death. 45% of the patients in the immediate death category died of irreversible brain injury, such as lacerations of the brain stem or spinal cord, and 35% died due to hemorrhage resulting from injuries to the heart, aorta, liver, lungs, and pelvic fracture. Meslin et al. Showed that for death within 1 hour of injury, 46% were neurologic injuries and 31% due to circulatory collapse. These studies shows two most common causes of immediate death are head injury and hemorrhage. For early trauma death cause, similar to that of immediate death and represents less catastrophic injuries or better pre-hospital care and shorter transport times to the trauma centers. Trunki and Lim described that the cause of death in this group include major internal hemorrhage to the head, respiratory system or abdominal organs, or multiple minor injuries resulting in severe blood loss. Saweya et al., sorry if I mispronounce it, reported that among the deaths within 48 hours of injury, exsanguination was the most common. For late death, Trunki reported that 80% of late death in the hospital were due to infections or multi-organ failure (MOF). Similarly, Baker found that 78% of deaths after 7 days were due to sepsis and multi-organ failure. This figure illustrates the trimodal death peak. whereby the number of deaths increases during the first peak of immediate death, and the number of deaths lessens in the second peak, that means early death, and the late death. You are welcome to go through my DCO, Damage Control Orthopedic videos. Okay, everyone? Yes, we have reached to the end of this video. See you in the next one. Take care and bye.